Using an otoscope, inspect the external ear canal for serum skin lesions, pus, and blood. Attach the speculum to the otoscope and tip the client's head away from you and straighten the ear canal. Hold the otoscope either the right side up or with your fingers between the otoscope handle and the client's head, or upside down with your fingers and the ulnar surfaces of your hand against the client's head. Assuming that we have an otoscope. Inspect the tympanic membrane for color on gross hearing acoustic test. Assist the client response to the normal voice tones. If the client has difficulty hearing the normal voice, proceed with the following test. Don't give mo, ma'am. Okay, ma'am. Perform the watch tick test. Have the client include one ear out of the client's type. Place the ticking watch to 2 to 3 centimeter inches from the unclouded ear, as what the client can hear. Repeat with the other ear. Paminawa, ma'am. Padungog pa nimo, ma'am. Nadungog mo, ma'am. Perform tuning fork test. Perform a Weaver test. Hold the tuning fork, its base activity, it by tapping of the fork gently against the back to your hand near the knuckles, or by stroking the fork between your thumb and index fingers. Place the base of the vibrating fork on the top of the client's head and ask whether the client hears the noise. Conducting Rini test. Ask the clients to the block of hearing in the one's ear in the intermittently by moving a fingertip in and out of the air canal. Holds the handle of the activity toning fork of the masteroid process in one until the client states that vibration can no finger led by heard. Hold the handle of the activity toning fork with a measure process of the one ear until the client has states that vibration can longer be heard. Immediately hold the vibrating fork palms, if any, from the clients can hear the canal. If necessary, push the side clients here. Ask whether the clients now hear the sound. So, ma'am, do you clear? Kadungog ba kagkuan? Clear, ma'am? Tarong? Okay, ma'am. Document the findings if the client assessing the nose and sinuses preparation. Assemble the equipment, nasal speculum, flashlight, or pin light. Procedure. Inquire the client has any history of the following. Ma'am, do you have allergies? Difficult of breathing and through the nose? Sinus infections? Injuries to the nose or face? Nosebleed? Any medications taken? Any changes in the sense of smell? Position to the client comfortable and stated the possible. Note 3. Inspect the external nose for any deviation in the shape, size, and color, and flaring or discharge from the nears. Lightly palpate the external nose to the determine any areas of tenderness, masses, or displacement of bone and cartilage. Determine the patency of both nasal activities. Ask the client to close the mouth, exert pressure on one nares, and breathe through the opposite nares. Sana ma'am? Close your mouth and inhale, exhale ma'am. Repeat the procedure to the assist patency of the opposite nares. Inspect the nasal cavities using a flashlight or nasal speculum. Hold the speculum in your right hand and inspect the client's lip nostril and in your left hand to inspect the nasal cavities using a flashlight or a nasal speculum. Hold the speculum in your right hand and inspect the client's left nostril and in your left hand to inspect the client's right nostril. Tip the client heads back, facing the client. Insert to the tip of the closed speculum about 1 centimeter or up to the point at which the blade widens. Care must be taken to avoid pressure on the sensitive nasal spectrum. Stabilize the speculum with your index fingers against the side of the nose. Use the other hand to position to the head. Then hold the light open of the speculum as much as possible. And inspect as much as nose the anterior portion of the septum, the medial meatus, and the medial turbinates. Inspect the lining of the nares and integrity and the position of the nasal septum. Observe for the presence of the redness, swelling, growth, and discharge. Inspect the nasal septum between the nasal chamber. Facial sinuses. Take the maxillary frontal sinuses for tenderness. Document findings in the client's record. Using the mouth and the Oropharynx preparation. Assemble the equipment and supplies. Clean gloves, tongue depressor. Since we don't have a tongue depressor, so I have this one pin-like procedure. Inquire the client has any history of the following. Ma'am, do you have a routine pattern on dental care? Last visit to the dentist. Length of time ulcers or other lesions have been present. Any denture or discomfort? Any medication the client is receiving? Position the client comfortable and skated if the possible. Lips and buccal mucosa. Inspect the outer lips for any symmetry of the contour, color, and texture. Inspect and palpate the inner lips and the buccal mucosa for color, moisture, and texture. and presence of the lesions. Teeth and gums. Inspect the teeth and gums while examining the inner lips and buccal mucosa. Open your mouth, ma'am. Inspect the denture as declined to remove the complete or partial denture. Inspect their condition and nothing and particular broken or worn areas. Yung nga, ma'am. Tongue floor or the mouth. Tongue floor of the mouth. Inspect the surfaces of the tongue for position, color, and texture. As declined to protrude the tongue and to move the from side to side. Kon, ma'am. Nga ma'am. Tapos imong dila i-side to side. Ano na, ma'am? Okay, ma'am. Inspect the base of the tongue, the mouth floor, and the frenulum as declines to place the tip of her tongue against the roof of the mouth. Itaas baba, ma'am, yung mouth. Ma'am. Palpate the tongue and floor of the palpate the tongue and floor of the palpate the tongue and floor of the mouth for any nodules, lumps, or excoriated areas. Use the piece of the guys gums on the tip of the tongue and with the index finger of your other hand, palpate the back of the tongue in borders and its base. Open your mouth, ma'am, and pagawas mong dila. Salivary gland. Inspect salivary duct openings for any swelling or redness. Salivary. Okay, ma'am. Palates and ovula. Inspect the hard and soft palate for color, shape, texture, and the presence of bony prominence as the client to open the mouth wide and tilt the head backward. Then depress the tongue with the tongue blade as necessary to use the pin light for appropriate visualization. Open your mouth, ma'am. And pagawas yung dila, ma'am. Inspect the ovula for position and mobility while examining the palate. To observe the ovula as the client to say so that the soft palate raises. So, ma'am, open your mouth and say Oropharynx and tonsils. Inspect the oropharynx for color and texture. Inspect one side at time to avoid eliciting a gag reflex. To expose side of the oropharynx, press tongue and blade against the tongue on the same side about the halfway back while the client tilts head back and opens the mouth wide. Use the pin light for illumination if needed. Open wide your mouth, ma'am. Thank you, ma'am. Elicit the gag reflex by pressing the posterior tongue. Tongue with the tongue blade. Document the findings in the client's record. Assessing the NIC procedure. Inquire if the client has any history of the following. Any problems with neck lumps, ma'am? Neck pain or stiffness? When and how any lumps occurred? Any diagnosis of thyroid problems or any treatments such as surgery or radiation? Neck muscles. Inspect the neck muscles for abnormal swelling or masses. Ask the client to hold the head creak. Head movement and the client to move the thing to the chest. Observe the head movement as the clients to move the chin to the chest. Doko ma'am. And hangad. Move head back to so that the chin points upward and move head so that the ear is moved toward the shoulders on each side. Turn to the head to the right and to the left. Turn to the paubos ma'am, pataas. Kadong dito ma'am. Kadong dito ma'am. Okay ma'am, thank you ma'am. And next one is assist the muscle strength. Ask the client to turn head to one side against the resistance of your hand and repeat with the or other side. Shrug shoulders against the resistance of your hands. So, ikaw mo. Lymph nodes. Palpate the entire neck of the enlarged lymph nodes. Palpate the trachea for lateral division. Place your fingertip or thumb to the trachea in the suprasternal notch, then move your fingers laterally to the left. Inspect the thyroid gland. Stand in front of the client and observe the lower half and the neck overlying thyroid gland for symmetry and visible masses. Ask the client to hyperextend head and swallow. If necessary, offer the glass or water to make it easier for the client to swallow. And yan naman mo lang. Yan ma'am. Ton lang ma'am. Okay ma'am, thank you. Palpate the thyroid gland to smoothness. Note of any areas enlargement, masses, or nodules. Auscultate over the thyroid area for Broyd. Use the belt-shaped diaphragm of the stethoscope. Document the findings in the client's record.